Mulago's operations is the Department of Internal Medicine, led by Dr. Christine Sekaja. It is here where Uganda's most complex cases find answers.
The Department of Internal Medicine, where I am based, is the department that manages the adults who have various diseases. We have different departments, different units under this department. These include neurology, where we take care of people with largely stroke and other problems that are related to the brain. We have people who take care of people with diabetes. Those are the endocrinology team. Cardiology, which is the heart. A lot of people with hypertension and other heart diseases are taken care of here. We have patients who have kidney disease, where we are who are managed in the nephrology unit and receive dialysis. We have a large dialysis department. Hematology department takes care of people with blood disorders, clots. We have a sickle cell disease service that happens here. We also look after people who have lung diseases. Those are the pulmonologists. And under that we have the tuberculosis clinic. Mulago Hospital has one of the largest multi-drug resistant clinics here. So that falls under the pulmonology unit. We take care of old people. So there's the geriatrics clinic, which is largely for people who are over the age of 60 years. We have a skin clinic as well, which is the dermatology unit. Various skin diseases like eczema and boils and leprosy, we take care of those here. We have a department dealing with infectious disease. Our infectious disease department takes care mostly of people who are living with HIV, but other infectious diseases as well, including malaria and typhoid. So we have over 11 different departments under medicine. So we also take care of people with joint diseases, that's rheumatology, and people with problems with the stomach, gastroenterology, people who have big livers or diseases with their pancreas. So these are the various specialties that we have in the hospital. These can be provided as an outpatient service. Every day there is an outpatient service that happens here in Mulago under these specialty units. And then we also have an inpatient service where people are admitted on the ward under the different specialty units. Now the outpatient service runs daily, and you'll find specialists under these different units. We provide the medication that is available for specialty care, and we provide the specialized investigations. Under the different specialties, for example, cardiology, we're able to do scans for the heart, the ECG echo. For the neurology patients, we're able to provide CT scan and look for the causes of convulsions by providing EEG services that can look for why or the source of your convulsion.
With each department comes a story of patients seeking hope and specialists pushing the limits of available resources to save lives.
I was not okay. I was not eating. I lost weight. After the operation, they did the operation after a week after the checkup. It was not easy. It was not easy. After 2 months, I started gaining. I started feeling better. I can't even walk alone. I was not walking alone.
Right.
This was a good doctor. He did a very good job on me, and I appreciate it.
Kyenkubira abantu Omulango bagonja okubawulira nti baveeyo mangu nnyo ng'omuntu obudde akantu kakutteko ku bulamu bwo ojje weekebeze, kijja kuwa buki, kijja kuwa obwangu bw'okujjanjaba.
Mulago is not just a hospital. It is Uganda's primary training ground for the next generation of doctors and specialists.
Mulago Hospital is the largest training institute for medical doctors and nurses in Uganda. We collaborate very closely with Makerere University. Under our different specialties, we offer undergraduate and postgraduate training in collaboration with other universities, but largely Makerere gives us the largest number of students. So our day-to-day work is teaching as well. During our ward rounds, we walk around with large groups of both undergraduate and postgraduate students. So you'll find young men and women who are aspiring to be doctors working closely with us, either in the outpatient clinic or in the wards during the ward rounds. And you also find doctors who are aspiring to become specialists conducting ward rounds with us on the wards or in the outpatient clinics. We provide super specialization as well. For example, we are soon to have training in after you've become a physician, we'll soon be training people to become skin doctors or dermatologists. We'll soon be training people to become lung doctors or pulmonologists. So we will soon be offering super specialization services within the hospital. However, in collaboration with Cancer Institute, we already offer training, subspecialty training in blood diseases and cancers. And together with Heart Institute, also in cardiology services. So the hospital offers various training opportunities. We have patients with several medical conditions in this hospital and offers a very good opportunity for learning for both undergraduate and postgraduate students. We even have fellows who are training in research. We have several collaborators within Uganda, outside Uganda, collaborating with us in research. Research contributes to patient care. For example, on our infectious disease ward, we have cryptococcal meningitis. We have studies on meningitis that are taking place that really contribute supplies, their brains, their teams of people who come to take care of people with meningitis, with tuberculosis, and in the process of doing research, they provide care, they improve patient care just by conducting research. But also the findings they have, the research findings help improve our patient care. Some of the work that has been done by the people who are researching on meningitis has been put in guidelines and altered the way we actually treat meningitis, especially in people living with HIV. A lot of clinical trials are taking place within in the space of HIV especially, and the infections that are related to HIV.
Any groundbreaking intervention as a result of research that of interest that you may give us, for example?
So as a result of the research that is happening here, the treatment of meningitis changed from using one single drug to using a combination of drugs, and those results came out of work that is being done by people in this department, especially in the infectious disease team.
This dual role as healer and teacher cements Mulago's place as the nerve center of Uganda's health sector.
With infectious disease specialists, we also have an infection prevention and control unit, which is an IPC unit, which is about infection prevention. So in case of an outbreak, these teams, which are already existing, are activated. And then we set up points for screening at different entry points of the hospital. We set up screening tools and we set up isolation centers. These places are already in place, but in case of an outbreak, the teams are reactivated and the spaces are reopened to isolate patients, early detection and isolation to prevent spreading diseases to other patients who are here.
All right. Do you find any moments when you really need more staff, especially during outbreaks? For example, there was a time when you had an outbreak of Ebola. At the same time, we had measles around town. Then, almost at the same time, there was a threat of, was it cholera? And this being a referral, how do you manage the crowds? Do you ever get staff from outside? Do you ever reinforce staff from outside? Or is the staff that you have on standby and ready?
So staffing will always be an issue, especially during outbreaks, as mentioned. So during outbreaks, the Ministry of Health deploys additional staff to provide support to us, both nurses and doctors. So we do receive extra boost in staffing during outbreaks. And these will help us, during the outbreak, and then after the outbreak we go back to our normal staffing levels. We work very closely with several partners on the Hill, on the Mulago Hill, especially in the space of infectious diseases. The Infectious Diseases Institute under Makerere University is supporting us in provision of services. For example, they're going to support us during the Mpox to provide care to patients with Mpox. We also get a lot of support in the space of HIV care, with testing, with treatment, because the numbers would be too overwhelming if we were to do it alone. So there are several places that patients who are living with HIV can go to that are outside the hospital. Yes, we have an infectious disease clinic that supports care. So in the general principle is that when you are discharged for any one of our specialty units, you continue to be seen in our outpatient clinics, in the different specialty outpatient clinics. But the hope is that we'll stabilize you enough and provide information for you to go back to your primary healthcare facility to have long-term care and only come back when there are complications. That's the only way we can manage the numbers here. So we have many people on the Hill in the space of, for HIV, we have MJAP, we have Infectious Diseases Institute, we have Baylor Institute, we have Muju. So there are various people who can support with that. But for the other diseases, especially the non-communicable diseases, which are chronic diseases, we get the support of our primary healthcare facilities, where we hope that we can send patients back and they can continue with care. And we can still keep in touch through documentation and reports about the patient in case there's a problem, but care, continuous care should really be, when a patient is stable, should really be in the lower level facility.
But for all its achievements, Mulago faces formidable challenges. From limited resources to patient overload, the hospital remains stretched.
So one of the challenges we face in the hospital is drug stockouts. While we do get large supplies of drugs, the numbers are overwhelming and the drugs run out very fast, just like the other supplies. While we do get them, they're consumed faster than we bring them back in. The other challenge we have, of course, is staffing. We have more patients than we have enough doctors and nurses to take care of them. We are blessed to have support from partner institutions like Makerere University, who provide a whole lot of staff as well to support care, both out and inpatient care. But still, we need more staff, both at the senior specialty level and the more junior medical officers. And we also need more nurses for our departments to run well. We know that patients will not get better without good nursing care, so key would be sufficient nursing staff to make this place run better.
The global challenges of healthcare are magnified here, balancing increasing patient numbers with limited infrastructure and funding.
So prevention of non-communicable diseases is key. We are having a lot of young people presenting with diabetes, hypertension and heart disease, with strokes. A 30-year-old coming in with a stroke. A lot of these things can be prevented by lifestyle. Not having a sedentary lifestyle, so doing exercises, eating right, reducing on the sugar, the high sugar intake, reducing on the high salt intake, having regular checkups. We need to have a lifestyle of regular checkups. Every year, go to your doctor, do the basic tests. Come to the hospital and do basic. Check your kidney, check your liver, check your heart, your pressure, your sugar. Those are basic tests and they're not very costly and are done here for free, that can be done on a regular basis from even a young age. Prevention is key. For the diseases that are passed on, for example, sickle cell disease, early testing. Everybody should know their sickle cell status. Everyone should know whether they are a carrier of sickle cell disease, because when two carriers come together, we're going to have a higher, very high chance of having children with sickle cell disease, and then the disease just goes on. So we need to be able to screen early for both communicable and non-communicable diseases. So the communicable diseases, which are transmitted from person to person, the infectious diseases, HIV, test early, start treatment early. Right now we're running a test and treat program. As soon as you're tested positive for HIV, you're started on treatment. If you started on treatment early, you don't come with the complications of HIV. So then we'll have less and less people falling critically ill, and less burden on the healthcare system. So prevention is key, testing early, screening early, regular checkups, healthy lifestyle. Being a very large institution with lots of staff, we get a lot of masqueraders. People pretend to be doctors, or people who once worked here and are known come back and pretend to continue to work here. But how have we managed to try and control patients being fleeced? Well, we ask people to always wear their uniform, the correct uniform, with identification on the uniform, walk around with their identification cards. We also have a security system that we have security that helps identify people who may be masquerading as healthcare workers and they're not. And sometimes they are healthcare workers, but just not healthcare workers for Mulago. We also have a notice board at the entrance, a big screen at the entrance that has pictures of people who in the past have been identified as masqueraders, or people masquerading as healthcare workers. And so this is put up every day for people to tell people that if you see this face, don't deal with this person.
Yet, against the odds, solutions are taking shape. Mulago has been steadily modernizing, introducing new technologies, forging international partnerships, and emphasizing capacity building.